Thank you, Dr. Landis. Our final presenter today is actually joining us online virtually. Unfortunately, we're not able to be here, but we're very excited that she was able to present virtually. This presentation will be given by Mediatrice Nyonsaba, who holds a master's in epidemiology with a bachelor's degree in anesthesia. She's a nurse anesthetist, completed her degrees at the University of Rwanda. And from 2012 until now, Ms. Nyonsaba has been working at the Rwanda Biomedical Center EMS division as an anesthesiologist nurse, whereby she provides pre-hospital treatment to patients with emergency conditions. So please welcome Mediatrice Nyonsaba to present Factors Associated with Mortality Among Trauma Patients, a study using trauma registry data from 2 Rwandan university hospitals.
Thank you, Alex. Hello, and thanks to everyone here present. As mentioned, I'm Mediatrice Nyonsaba. I'm from Rwanda, and I serve in emergency medical services. It's really a great honor for me to be here today, and let's discuss about the factors associated with mortality among trauma patients, a study using trauma registry data from 2 Rwandan university hospitals. So again, let's declare that no conflict of interest related to this study. And this research didn't receive any special grants from any agency, whether public, commercial, and profit sector. This study has been approved by the University of Rwanda, and data access was authorized by Rwanda Biomedical Center, as they are the one holding trauma registry. All data used in this study were secondary data records to ensure confidentiality and compliance with ethical standards. On background, you all know that trauma is the top leading cause of disability and death worldwide, with up to 4.4 million of deaths each year. And for road traffic accident, they are the major contributors. Luckily, it can be prevented. The other concern is that in this burden related to trauma, more than 90% of global trauma death is happening in a low and middle-income country where Rwanda belongs. In Rwanda, trauma care services has been improved in recent years. Unfortunately, we still have higher records of mortality in this type of patients. This can be attributed to inconsistency in access to timely and specialized care. You can ask yourself, why did we do this study? As I said earlier, Rwanda has improved trauma care, yes, because now there is we have every single year we have graduates from emergency and critical care medicine and the other specialty who can tackle the emergency, but we still have this concern. We did also this study, as said earlier, Rwanda hold a trauma registry, and we need to analyze those data from trauma registry to see what it tells with regard to policymakers and the clinical practices. We need also to use this trauma registry data to identify the risk factor which can be tackled and reduce this concern. What were the objectives? The objectives for this study was to assess the magnitude. I was wondering, what is the magnitude? Is it really a concern? And I conducted this analysis for the trauma registry data from the Kigali and the Butare University Teaching Hospital. Those hospitals, they are the topest hospital in Rwanda who are caring for trauma patients. The other objective was to identify the key risk factors to inform targeted intervention in order to improve patients' outcome. Those pictures, they are the one for the Kigali University Teaching Hospital located in the capital city of Rwanda, which is Kigali. And the other one, the CHUB, is another university teaching hospital in rural area in the southern province. To answer to our research question, our method was a retrospective cross-sectional study. We used secondary data from 2019 to 2024. Our total population was 11,228, excluding those patients with minor injuries. We analyzed the data on demographics, injury characteristics, diagnosis, and treatment modalities. We analyzed those data using this data version 15, and we computed odds ratio and 95% confidence intervals for statistical analysis. So what did we find? Well, we found that on key demographics, 72.5% of our participants were male, 58.1 were aged between 15 to 44, 19 to 49 were using a community-based health insurance, and 27 had any insurance. The mean age was 33.6 plus or minus 19.5 years. And on our findings, we found that severe traumatic brain injury and low systolic blood pressure are still on higher concern because many patients with increased rates of death are in this category. What was our magnitude? We found that the overall mortality was 10.8%. You can see that this is an intolerable number with regard to all the resources which has been put in the press. What are the factors found to be associated with mortality? First one, we saw that those patients who are presenting in the hospital with 2 or more serious injuries, they are more than 6 times likely to die due to those injuries. Being either more than 65 years is also a contributing factors to death. As said, low blood pressure at admission is around 2 times more likely to die. And the other factor we saw to be associated with mortality is having received hospital care. This factor was found to be a protective factor, as those who received the hospital care, it protects them from death. Yes, let's conclude. On conclusion, you can all see that the mortality remains high among trauma patients treated at Kigali and the Butare University Teaching Hospital. And among the factors identified to be associated with death, some of them are modifiable. So there is a possibility to tackle on those factors and have a better response with regard to mortality. What do we recommend? Based on the findings from this study, we recommend that there is a more to need to strengthen trauma care in those public university teaching hospitals. There is also a need to enhance multidisciplinary trauma care, as we saw that having more than 2 injuries, you are subjected to death. So there is a need to increase the response of a multiple team of general surgeon, radiotherapist, anesthesiologist, everyone who is responsible to respond. There is also a need to improve the response to pre-hospital care, because we saw that it's a protective factor which can reduce the mortality. There's also a need to focus on blood pressure control and severe traumatic brain injury management. So thanks to the University of Rwanda, thanks to Rwanda Biomedical Center, thanks to the ICM 2025 organizers, and thanks to you all for your kind attention. If anyone has a question, a concern, please welcome.
Thank you very much, Ms. Nyansaba, for your wonderful presentation and for being able to join us remotely this morning. It's wonderful to have you be part of our conference.